Welcome back to Scissors and Scrubs. I'm Nicole.
I'm Laura.
And you guys almost lost me. Laura was almost doing the podcast by herself. Yep. I almost died last week.
I just would have stopped. But
wow.
Let's be honest.
This has been yeah, you would have. You'd be like, and we're done here.
And we're done. She's dead and we're done.
You'd never hear from us again.
No.
I got the flu, and I'm pretty sure I was giving away my personal belongings last week because I was dying. Mm-hmm. So I sound great, and you're going to hear my cough drop clacking around, and you'll probably hear me coughing because I'm pretty sure I'll have this for the next 3 years.
Probably.
So that being said, this week we got, not this week we didn't get this, we got a Facebook message, a little while ago. And she had referred to, I read that book, Brain on Fire. Mm-hmm. Did you read that book?
No, I have to.
It's excellent.
Yeah.
It's excellent. It's written by Susanna. I love when people spell their names it's like Susanah Cahalan. Cahalan.
Oh.
But she wrote it. It's her autobiography on her issue with this disease. So I mentioned that in 2021.
Jeez.
And Missy wrote to us and she sent us a little message and she wrote, "So have fallen in love with your podcast. So have I. But apparently if I die, you'll never hear it again."
Well, I mean, it would just be sacrilege.
I have been a pediatric PICU nurse for 22 years. I was listening to your Easter 2021 episode and heard you briefly bring up Brain on Fire. She had anti-NMDA, autoimmune encephalitis. It's a rare, crazy disease, and my 15-year-old daughter had it. Holy jeez. Yeah. Good thing you're a PICU nurse. It was the craziest ride I've ever been on. She went from a normal straight-A student cheerleader to catatonic and dying in 2 weeks. The part that isn't portrayed in the book is the recovery. The onset can be so fast, and the recovery took her 18 to 24 months.
Crazy.
She had to learn to walk, talk, eat, and behave all over again. She went through plasmapheresis, IVIG, rituximab, steroids, and eventually cytosine before her immune system calmed. She is now 19 and a sophomore in college and on the dean's list. She had no residual symptoms and is thriving, but that was the longest 2 years. I lost my place. 2 years of my life. I would love it if you could do an episode on this. My goal is to bring awareness to healthcare workers. In the beginning, these patients present with psychosis and bipolar symptoms, and most of them end up locked up in a psychiatric ward instead of getting the medical treatment they need. If you have any questions, please let me know. I love listening to you ladies and love sharing with my coworkers. So she's correct because this girl in the book, all of her symptoms present like she's having almost a schizophrenic episode. Mm-hmm. And she goes through hell before this rando doctor. You know, it's always like this one doctor that you happen to come across. He knew what it was, and her recovery was intense.
That's awesome.
So first, Laura's going to discuss what encephalitis is.
Yes.
And then I'm going to get into the NMDA encephalitis.
Yes. All right. So encephalitis is a rare but very serious condition that causes inflammation in your brain, which means your brain is going to swell, right? It can occur as a result of an infection or an autoimmune disorder. Treatment varies depending on the cause, but most people with encephalitis require hospitalization so they can receive like intense treatment and life-saving measures.
Brain infections are no joke.
No joke. Your brain does everything. Nope. There's types of encephalitis. There's infective encephalitis and autoimmune encephalitis. So like that woman that wrote in, her daughter had an autoimmune encephalitis. Infective encephalitis includes viral encephalitis, and this is the most common form. And you can develop viral encephalitis having certain infectious diseases or viruses. There's arbovirus encephalitis, and that's when you get bit by a mosquito, a flea, a tick, and that spreads infections that then cause the swelling in your brain and encephalitis. In autoimmune encephalitis, your immune system mistakenly attacks your brain, causing inflammation that may affect how your brain works. This sometimes happens to people with cancer, and that's called paraneoplastic syndrome. Symptoms of encephalitis: fatigue, headache, high fever, neck stiffness, confusion, drowsiness, memory issues, loss of consciousness, nausea and vomiting, speech issues, personality changes, weakness in your parts of your body, and seizures. The speech issues, personality changes, weakness in the different parts of your body, and seizures are usually the autoimmune encephalitis. Early warning signs, they're a little confused. they have a headache. They might have a little fever. It doesn't come off as anything super serious. So it can be like really
Anytime I have a
easily
stiff
missed.
neck, I'm like, oh, I have encephalitis. I'm dying.
No, I think,
Meningitis. Meningitis, that's what it is, yeah.
Infectious encephalitis usually comes on quick. Like it's all of a sudden. Autoimmune is usually a little bit slower. Like there's little signs, but you're just not picking them up until it becomes like a...
Too bad.
Yeah. Infective and autoimmune encephalitis can be life-threatening. If you have these symptoms, you need to go to the hospital, call 911, get treated as soon as you can. What's going to happen when you get to the hospital? The physicians are going to do a physical exam. They're going to ask you about your symptoms, how long you've had them. They're going to do blood tests with a CBC. They can see your white blood cell count, which shows infection. They're going to do a comprehensive metabolic panel. They're going to do imaging tests like a CAT scan or an MRI. They can do a lumbar puncture, which tests the
those look painful.
Spinal fluid. I had one time.
They look painful.
Yeah, it wasn't fun. And a neurological exam, obviously, since these are all neurological symptoms. There's different treatments depending on the encephalitis you have. They're going to monitor you. If the symptoms get worse, they usually get worse quickly. They'll give you anti-seizure medications, especially if it's an autoimmune encephalitis, because that is more likely to lead to seizures. Antiviral medications, especially if it's a viral encephalitis, like acyclovir that you take for what's it called?
Nose. Is it your nose?
No, acyclovir is for
herpes.
Yeah, herpes. Breathing assistance. If you become unconscious because of encephalitis, you're going to need to be intubated, and we're going to breathe for you.
You're going to need to be sported like the Pope.
Yeah.
He's on mechanical support, Laura.
I heard he's not anymore.
No, he's on a CPAP or a BiPAP.
Oh.
And the nasal cannula.
Oh, well, that's not too bad. Like
but the way they worded it was like, oh, he's on, aided help with breathing. I'm like, he's on a CPAP. That's what they put on.
Well, I mean, they are helping.
Well, he's 80. He's half dead.
They're going to give you corticosteroids. Both viral and autoimmune encephalitis cause the inflammation and swelling in your brain. So the steroids will help bring the swelling down. And then that will bring the pressure in your brain down. Enteral nutrition, which means if you're unconscious from your brain swelling, we're going to give you tube feeds to support your
that's always good.
nutrition. Oh, God, it's the worst smell. And it always spills. Immune globulin, helps treat autoimmune encephalitis. I think the person who wrote in said her daughter had that. IV fluids, you're not going to be able to eat and drink if you have severe encephalitis, so we're going to give you IV fluids. Mental health support. Encephalitis can cause memory issues, personality changes. You're going to need to be seeing a therapist or a psychologist.
Affecting your brain.
Yep. Physical therapy. It can cause you to be off balance. It can cause you to have a hard time to walk, so you're going to need physical therapy to get you back into your normal health. Plasmapheresis, which that woman also referenced, also helps treat autoimmune encephalitis. Viral infections and viruses carried by the insects are the most common causes of encephalitis. You can reduce your risk if you're going to countries that have the Tripoli and stuff. You can get vaccinated. You can also protect yourself from mosquito bites by wearing protective clothing, using insect repellents, keeping your property dry. Mosquitoes like still water. Using screens and fans. I know when Garrett was in Costa Rica, like they didn't have fans. I'm like, screens. I'm like, I don't think anyone has screens other than us.
Where you can get all this stuff, they don't have screens.
Yeah. So use screens or like a netting or something around when you're sleeping. Encephalitis symptoms can come about in like a couple days, but they take months to years to go away. And people think like, oh, well, they had encephalitis, but they find out you're not your normal self for quite a while.
The recovery is intense.
Yeah. And medications do treat the underlying conditions, and that does cure encephalitis, like if you cure the underlying condition. But again, most encephalitis are going to have long-term issues and going to need ongoing medical care, especially if you have like the autoimmune, memory loss, speech, all of that stuff is affected, personality changes. So you're going to need a long recovery.
Well, this brain is on fire. I get my excuse me, I just choked. I'm getting my information from the Cleveland Clinic. So
I got that from the Cleveland Clinic.
Yeah. Well, they're wicked smart over there at the Cleveland Clinic. So this particular encephalitis is called anti-NMDA receptor encephalitis. This article was very technical, so I tried to break it down. I had to do a lot of looking up because I didn't know what a lot of shit meant. So be patient with me. Okay, so it stands for, the N is methyl, which makes no sense. The D is aspartate, and this describes the actual chemical makeup of the receptor that is getting attacked. What is it? It is a neuroimmunological disorder mediated by intrathecal, that's my favorite word, autoantibodies against the GLUN1 subunit of the NMDAR receptor.
Oh boy.
It is sometimes preceded by a viral-like prodromal syndrome, so you get some kind of a virus, and it affects young adults, mostly female, though it is seen in children and elderly. The NMDA receptors are critical to the neuroplasticity of your brain, which is how malleable and adaptable your brain is and how it's able, if old pathways die, to create new paths. So it's attacking what's going to help you make new pathways and create new, make you more adaptable. So diseases that the NMDA receptors are affected by are Alzheimer's, ALS, Huntington's, Parkinson's, epilepsy. This is just to give you an idea of what these receptors do. So those are, if the NMDA receptor is affected, those are the diseases you get.
Like terrible
diseases. Yeah. Which, if you remember, like Alzheimer's, they can't build new pathways. ALS, they can't build new. It's all those things where it's a neurologic disorder, nothing new is growing. So the anti-NMDA receptor encephalitis creates autoantibodies against these receptors. So it's attacking itself. Two possible triggers or risk factors are tumors, the ovarian or the tetraomas, which the dermoid cysts, which are disgusting. We've talked about them in the past. It's a big ovarian cyst that has hair and teeth and weird shit in it. It's disgusting. And herpes simplex encephalitis. 27% of patients develop autoimmune encephalitis 2 to 16 weeks post-infection. 64% of those are anti-NMDAR encephalitis. Oh, wow. How people with anti-NMDAR present. The symptoms, like a virus, are going to start first. You're going to get a low-grade fever, general malaise, anorexia, and a headache. After the virus passes, you will likely experience progressive behaviors and psych symptoms and later neurological symptoms. They can come on very fast, sudden onsets. The behavioral and psych issues are what sends patients to seek help. The neurologic symptoms occur within days to weeks following the psych symptoms. Things like seizures, cognitive dysfunction, hyperkinetic movements, i.e. tics, tremors, dystonia. If the cognitive occurs at the same time as the psych, this is a main contributor to people with long-term disabilities. Yeah. So if they both come at the same time, you're more likely to be seriously affected by this disease. You're seriously affected by this disease. Let's just say that, okay? You're not getting out of this with unscathed, but you're going to have a much more long-term issue with it. Some patients can progress to impaired unconsciousness, autonomic dysfunction, and hypoventilation requiring an ICU stay. If it is suspected, So these patients are going to present, some of them present like schizophrenics, some of them present like bipolar. So often they are admitted into psych wards and misdiagnosed for an extensive period of time because nobody's looking for this. So if somebody is looking for it and they suspect it, they will do a complete CSF panel, cerebral spinal fluid panel. They are looking, it's a very specific testing they do for this NMDA. They are looking for the presence of intrathecal antibody production and presence of CSF, I can never pronounce these words, pleocytosis. They'll do an EEG, they can do an MRI, or they can do a whole brain, they may do all these together, whole brain or body, FDG PET scan. The problem is the CSF panel takes so long that they will do these other tests and come up with the tentative diagnosis, and they may start treating you before they have definitively diagnosed it. The earlier that detected this, the better the outcome. 3 criteria need to be met for diagnosis. 1 rapid onset, less than 3 months after your initial herpes outbreak or infection, or abnormal psych behaviors or cognitive dysfunction, speech dysfunction like pressured speech, verbal reduction or mutism, seizures, movement disorders, a decreased level of consciousness, autonomic dysfunction, or central hypoventilation. 2, lab results. You'll have an abnormal EEG, CSF with pleocytosis or oligoclonal bands. It's the way the bacteria presents itself. And number 3, reasonable exclusion of other disorders. A diagnosis of probable NMDA can be made with the symptoms I described above, the abnormal psych behaviors of cognitive dysfunction, and you have a presence of a dermoid cyst. If you have those symptoms and a presence of a dermoid cyst, they're going to say you probably have this. It is definitive when you have the above symptoms and they come back with the positive CSF tests. Treatment. The most common is high doses of corticosteroids, IVIG, and plasmapheresis, usually 5 sessions over 7 to 10 days, along with antibiotics and treatment of the neurological, psych, and cognitive symptoms. So they might still be, if you're having all these symptoms, they're going to treat you with psych drugs as well, anti-seizures, stuff for the kinetic movements. They're going to give you things to treat. You have to treat both of these at the same time. These patients commonly experience long-term complications, and some may even have a relapse. Most patients see improvement after immunotherapy treatment. Some see improvement several years after all this treatment. You want to support these people with OT, PT, psych consults, and you have to be prepared for a long-term recovery on these patients. So that is my brain on fire with NMDAR, whatever the hell, A, B, C, D, E, F, G receptors. It was very technical.
That is very
It took a lot out of me to write that. But that book was excellent.
I have to read that.
This girl went through hell. And I'd forgotten a lot of it. She had a boyfriend during it and went to see his family and had a complete episode with the family, and they were like, what the fuck? And then she wasn't getting married, and then she was getting... I'd forgotten a lot of it, but it was excellent. Like at one point, she's in the hospital, and they put pictures in there of the nurse taking care of her that it took her like a month before she even realized she was in the hospital. And she was convinced her father was trying to kill her. So her poor father would come in and she would attack him.
Oh my God.
So he would sit outside her room every day just to make sure she was okay. She doesn't remember any of it. And the nurse would tell her what she was like when she came in. Mm-hmm. And then eventually, like after a month, the clouds cleared and she came out of it and was like, her father wouldn't really go near her. She's like, what's your problem? And he's like, you're going to attack me? She's like, what are you talking about? So it's an excellent book. If you get the chance to read it, it's a good read.
That has to, you just have a herpes and then a month later you're out of your mind.
Crazy. Yeah. But you really hope that somebody recognize
that you're not locked up in a unit.
Exactly. Or you're going to be 6 months in McLean's before somebody figures out you got a bigger problem than that. So this was a short and sweet episode, mainly because I was dying. And we will catch up with you in 2 weeks. It's frigid cold out in the middle of March right now, and I hate it. This is the worst month ever. But spring is coming, people. It's happening.
It's going to be.
It's happening.
It was sunny till 6 o'clock today. Mm-hmm. Time fall.
Sun was shining in our eyes while we were eating dinner. Yeah. It was lovely.
It springs ahead Sunday. So
I was walking on the way to work the other day, and I passed the shrine, and outside all the little buds were coming out of the ground.
Yeah.
I was like, oh my God,
it's happening.
It's happening. These are going to be buds in 6 weeks.
There's hope. I have hope
there is
every
hope.
Day now. Yep.
Lent starts Wednesday?
Wednesday.
And so that means Easter's on the other end, which is late in April this year.
Yep.
I'll take it.
We're almost there.
I'll take it.
We're almost there.
All right. So we'll see you in 2 weeks when the sun's out a little longer.
Yay.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.